Hi, I'm Scott Bainbridge, and I am presenting a multi-part video series on physical examination, and we are doing spine-specific, low back-specific exams as well, but this particular video will be my screening neurological exam. And so I have already spoken with the patient, observed their cognition, speech patterns, affect, etc., and I'm going to get into the remainder of the neurological exam, which I'll start with reflexes. Obviously, I'll do both sides in a normal exam. I'll focus on one side for the purposes of demonstration and to move the video along. And we'll start with biceps reflex. I tense the tendon and obtain that reflex. So C5-6 reflex, brachioradialis, more C6, triceps, C7. They're often mixed a little bit, 6 and 8 in there. And I'll work down patellar reflex, L2, 3, 4, probably more 3, 4. Achilles, primarily 1, maybe some adjacent roots as well. Then I'll do plantar response, looking for that Babinski response. Hers is normal. Check clonus with an abrupt pull-up of the foot. And I'm looking for 1 or 2 beats is normal. You get into the 4 to 6 or sustained category, then that's abnormal. Then I come back up and I'll do Hoffman's. And I flick the fingernail of the 3rd digit. I'm looking for a grasping. If that happens once or twice but extinguishes, that's fine. If it continues, that's abnormal. We'll do sensory testing. I use a pinwheel and ask for any abnormalities. Does it feel dull, hypersensitive? Are there changes side to side? C5 kind of down in this police patch or lower area. Up in here we have some C3, 4, it depends on who you read. C4 may be further out, a little mixture, 3 and 4 in here. We'll go down to the dorsum of the hand towards the thumb side, radial side. This is a C6 and 7 crossover. I'll go to the palmar aspect, and this is also radial sensory distally. Median nerve, C6, 6, 7 crossover, 3rd digit, C7. 4th digit is interesting, a little median on this side, ulnar on this side. We get into this 5th digit, C8, ulnar nerve. You can try to do some T1 testing up in here, and we'll go down to the lower extremity. I'll look at this L3 medial distal thigh pattern. I'll come up to the upper anterior thigh for L2, get just below the inguinal crease, L1, and then I can step up there if I need to, or go to the thoracic spine. I like this medial leg saphenous nerve, L4. That's where I go for that. Lateral, more L5, but it's a little bit of a crossover with some S1 occasionally. Dorsum of the foot, L5. Perineal distribution. Lateral foot, sural nerve, but S1 distribution. And again, checking both sides. I'll check strength. Arms up like this. Push up against me. So looking at deltoid, primarily C5. If they're very strong, I may use some leverage like this. Arms like this. Bicep, 5 and 6. Pull against me. Push out. This is tricep, primarily 7. Bring the wrists back towards you. So look at the back of your wrists and pull back and lock that wrist. And go ahead and lock and resist me. Primarily C6, fingers straight out, lift up with the fingers, C7, and spread your fingers apart. And these were radial nerve. This is more primarily an ulnar nerve function. Go ahead and spread apart against me. Very good. Squeeze my fingers. Squeeze, squeeze, squeeze. Primarily C8. Hold your thumb right there. I'm going to come at your thumb. You hold it steady. Don't let me move it. Ductor pollicis brevis. Median nerve, C8T1. This is also C8T1. We'll go to hip flexors. Hip flexors, L2, 3, primarily. Lift that knee against me. This can be weak even with cervical myelopathy. Sometimes this is one of the initial weak areas to show up. Push into my hand, extend that knee with the quads, femoral nerve L2, 3, 4. Pull back with those hamstrings, and that's a variety, L4, 5, S1, 2. Bring the feet up, pull up against me, and up and in, kind of a pattern like this, pull up and hold. Anterior tib, L4 and 5 mixture, bring the toes up and hold up, EHL, extensor hallucis longus, primarily L5, can be a little S1, feet up and out, ankle everters, S1 primarily, can be 5, a little S2, according to who you read. I'm going to have you stand and walk on your toes, looking at those gastrocs, largely an S1 function, and on your heels, and L4 and 5, looking for drop foot. L5 radiculopathies will show up as weakness with heel walking. I want you to walk normally but quickly to the corner, turn and walk back. And I'm often looking at gait, looking for spastic components, any other abnormalities of gait. The purpose of the quick turn is to see if there's any balance disturbance. Sometimes that's an early sign of myelopathy as well. Go ahead and face me with your heels together, arms in front. Close your eyes. With this finger, touch your nose. And with this finger, touch your nose. So we're kind of combining Romberg's finger-to-nose testing at the same time. Open your eyes. You can put one hand comfortably in front of you. Take your other, hit front, turn it, hit back, front, back, front, back. And alternating hand motions. Go ahead the other side. Kind of a coordination, cerebellar function among others. Look at my, and then I'll jump to cranial nerves. Look at my fingers, follow with your eyes. And in, close your eyes real tight and open. A little tough to see your pupils, but that's what I'm looking for. Nice smile, so I'm looking at that. Close your eyes real tight again. Close your eyes tight, 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 good. And open again. Stick your tongue out, back and forth, good. Can you hear this? Sound the same there. So these feel the same side to side. Push your chin against me. And here. All right. And then I'll get into other aspects of my musculoskeletal exam if indicated. I think that's a reasonable screening exam for general neurological function. Thank you.
Hello, my name's Dr. Gill. I've been asked to do an examination of the muscles and nerves that control your head and neck. Is that okay?
Yep.
Excellent. Can I just confirm your name and date of birth?
Yep, it's Rachel Birthday, 1st of April 1990.
Excellent. And have you had an examination like this before?
No, I haven't.
Okay. So to start off, we're just going to have a look at the muscles that control your face, if that's okay.
Yep.
So if I can get you to take your glasses off for me. Okay. First off, we're just going to see if you can blink properly, and that's going to involve me just tapping your forehead. So just relax for me. Okay, so we've got that's fine there. The next thing I ask you to do is raise your eyebrows up as high as you can for me. Okay, that's symmetrical. And if you can screw your eyes tightly for me. Now I'm just going to put my hands on your face and try and open those eyes. That's fine, thank you. You can open your eyes again. The next step, if I can get you to show me your teeth, please. So, excellent. And relax. And now if I could get you to blow your cheeks out, and I'm going to try and tap on the sides. So, okay, that's fine, thank you. The next thing I need to check, it's more about getting information from you. Have you noticed any change in your sense of taste at all?
No.
Excellent. Okay. So moving on from here, we're going to have a look at your sense of hearing, if that's okay.
Mm-hmm.
So are you aware of any difficulties with your hearing at the moment?
No.
Thank you. So I'm going to get you to close your eyes, and then I'm going to make a noise by each of your ears. I want you to tell me which ear you can hear a sound in. Okay. Can you get you to close your eyes, please?
Left. Right.
Thank you. You can open your eyes. The next bit of the examination we want to do, I'm going to get this tuning fork. I'm going to place it in the center of your head. When I do that, you'll hear a noise, you'll hear the vibration inside your head. I need to know if you can hear it in the center or if you hear it towards one ear or the other. Does that make sense?
Yeah.
Okay. So can you hear the noise?
Yes.
Okay. Okay, and is it central or to one ear or the other?
Central.
Okay, thank you. From here now, we're going to do the same thing again, but this time I'm going to place the tuning fork on a bit of bone at the back of your skull. Okay, and I want you to tell me when you can no longer hear the tuning fork. At that point, I'm going to bring the tuning fork to the side of your ear, and I want to know if you can still hear it.
Okay.
If I can just get you to move the hair back from your ears, thank you. Okay. So tell me if you can hear this,
Yep.
and tell me when it disappears.
Now.
Okay. Can you hear it now?
Yes.
Okay, that's fine, thank you. And we're going to do the same the other side. Can you hear it there?
Yep.
Tell me when you can't hear it.
Now.
Can you still hear it?
Yes.
Okay, thank you. Right. Okay. Right. If I could get you to take the glass of water and take a small sip for me and swallow it. Okay. And any problems with that at all?
No.
Excellent, thank you. I'd now like to shine a light on your mouth, if that's okay. If I can get you to open your mouth and say "ah" nice and long for me. And say "ah" for me. Okay, thank you. Okay. I'm now going to have a look at your shoulders and neck, if that's okay. So I'm going to put my hands on your shoulders, and I'd like you to shrug up against me. Okay. So if you could shrug for me, please. That's fine. And if you can do the same thing again, if you can push your head into my hand. Excellent. And I'd like you to turn into my hand, so push. That's fine, thank you. And if I can get you to touch your chin to your chest. Thank you. And all the way back for me. That's fine, thank you very much. And finally, if I can get you to stick your tongue out for me, please. Thank you. And I'd like you to push your tongue to one side of your cheek. Okay, thank you. And the other. Okay. That's fine, thank you very much. Have you got any questions yourself?
No.
Okay, thank you.